Sometimes fear arrives out of nowhere. You might be sitting quietly, driving home, or laughing with friends when suddenly your heart starts to race. Your hands tremble. Breathing feels difficult. A wave of panic rushes over you as if something terrible is about to happen, even though there is no real reason for it. That sudden, overwhelming moment is what we call a panic attack. A panic attack is a sudden episode of intense fear or discomfort that triggers strong physical reactions, even when there is no real danger. It feels like your body's alarm system goes off at the wrong time, warning you about something that is not actually there. These moments can be so powerful that people often believe they are having a heart attack or losing control. During a panic attack, the body reacts as if it is facing real danger. The heart beats faster, breathing becomes shallow, and the muscles tighten. The palms sweat. The chest feels heavy, and dizziness or tingling sensations might appear. Some people feel detached from themselves, as if they are watching the moment happen from outside their own body. These sensations rise quickly, peak within minutes, and then slowly fade away, often leaving behind exhaustion and fear of another attack. Panic attacks can happen to anyone at any time. They do not always have a clear reason. For some people, stress, trauma, or major life changes can trigger them. For others, they appear during calm and ordinary moments. Even caffeine, lack of sleep, or certain medications can make panic attacks more likely to happen. Genetics also play an important role. Panic disorder, which is when panic attacks happen repeatedly and unexpectedly, often runs in families. Scientists believe that the brain's fear center, called the amygdala, becomes overactive. The amygdala works like an internal alarm designed to protect us from danger. When it misfires, it sends out false signals that something is wrong. The body responds by releasing adrenaline and preparing to fight or run, even though there is nothing to fight and nowhere to go. That is what makes panic attacks so confusing. The body acts as if it is in danger, but the mind cannot see why. It is like an alarm ringing loudly in a quiet room. It is impossible to ignore, even though there is no real threat. It is also important to know that panic attacks are not the same as normal anxiety. Anxiety builds slowly and is often connected to a specific situation, such as an exam, an interview, or a big decision. Panic attacks strike suddenly and feel overwhelming, often for no clear reason. Anxiety rises gradually while panic arrives all at once. Because panic attacks feel unpredictable, people often start to fear having another one. They may avoid crowded places, driving, or being far from home. This avoidance can make life smaller and lonelier. Some people develop constant worry about when the next attack might happen. Over time, that fear can turn into agoraphobia, where leaving home begins to feel unsafe. Even though panic attacks feel dangerous, they are not life-threatening. The body's reactions, such as the fast heartbeat, trembling, and shortness of breath, are natural responses to fear. They are uncomfortable, but they are not harmful. The key to managing them is learning how to calm that false alarm. Treatment for panic attacks and panic disorder works very well. One of the most effective methods is cognitive behavioral therapy, also known as CBT. In CBT, people learn what is really happening during a panic attack and how to manage it. They practice identifying triggers, challenging fearful thoughts, and replacing them with calmer and more realistic ones. Therapists often teach breathing and relaxation techniques that help slow down the body's panic response. Taking slow and steady breaths sends a signal to the brain that everything is okay. Gradual exposure therapy, where people face feared situations in small and safe steps, also helps them regain confidence and control. Medication can also be helpful. Doctors may prescribe antidepressants such as SSRIs to balance brain chemicals and reduce attacks. Short-term anti-anxiety medications can provide quick relief, but they are used carefully to avoid dependence. Lifestyle changes can make a big difference as well. Regular exercise, enough sleep, and mindfulness practices help reduce stress. Avoiding caffeine, alcohol, and nicotine can lower the chance of triggers. Most importantly, having support from family, friends, or a counselor reminds you that you are not alone. Panic attacks are more common than many people realize. Millions of people experience them, including students, parents, professionals, and even children. Having a panic attack does not mean you are weak or broken. It simply means that your body's alarm system is reacting too strongly to stress, and that response can be retrained. Recovery is not about making panic disappear completely. It is about understanding what is happening and learning to respond differently. The first step is recognizing that what you are feeling is a panic attack, reminding yourself that it will pass and that you are safe. The next step is to breathe through it, stay grounded, and seek support if you need it. Over time, people who experience panic attacks often discover a quiet strength within themselves. They become more self-aware, more compassionate, and better able to handle stress. What once felt uncontrollable becomes something they can manage with calm and confidence. Panic attacks may be powerful, but they are not permanent. They are the body's false alarm, a signal that can be quieted with care and practice. With the right help, the alarm fades, calm returns, and confidence grows. The truth is that the panic was never stronger than you. It only felt that way for a moment. And like every moment, it passes.